Hello, Gold participants and listeners from around the world. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. And here at Gold, we're preparing and recording a brand new lecture pack titled Complex Medical Issues in the Lactating Parent. And we all know that medical issues in the lactating parent can often create difficulties with breastfeeding, chest feeding, and post challenges for the lactation care provider. And this special package focused on providing knowledge and skills to help with these situations. And before we publish our lecture pack, we always like to get together with our speakers and talk to them a little bit about their professional background, the presentation, and what they're working on. And today with me is Dr. Ilana Chertok. Welcome, Dr. Ilana Chertok. It's wonderful to have you here today.
Thank you. It's nice to be here.
It's so wonderful that you were able to take time out of your busy day to chat with me here a little bit. And so you are a professor of nursing, right? Tell us a little bit about your work there and also about your background in lactation.
Sure. So I am a lactation consultant as well as an epidemiologist, maternal infant health researcher. And my interest or passion for this really started when I myself was a first-time mother and before I'd finished some of my studies. And I had I'd run into some difficulty with breastfeeding, and the midwife with whom I gave birth sent over a lactation consultant to help me. And I was so impressed and inspired by the lactation consultant as well as by the midwife's care that I said, this is something that I think I want to pursue. And so that really started a lifelong interest for me. And with children, I went back to school and ended up first in nursing school, became a nurse, and felt like I still wanted to keep going. While I was in nursing school, I already started to train as an IBCLC lactation consultant, started my studies and preparation for that, as well as the training. And when after finishing nursing school, I went on for graduate degrees and did a doctorate in epidemiology, which is primarily public health research, with a focus in maternal infant health or maternal child health. I studied under a perinatal researcher, and I did my doctoral studies. Some of my graduate studies I did in America and some of them in Israel, and my PhD, my doctorate, I studied in Israel at Ben Gurion University in Beersheba, which is in the southern part of Israel. And it was fascinating because maternal infant health, even though the entire country of Israel is all under universal health coverage, there's a difference in access to care and health disparities that the different populations face. And so that really came out in maternal infant health specifically. So breastfeeding rates, for example, were lower in the southern part of the country. And sure enough, there were fewer lactation consultants down there too. And so that really started an interest for me in how to try and promote breastfeeding in an at-risk population. So while I was in nursing school back in Chicago, I actually worked as a research assistant to Dr. Paula Meyer, who worked with NICU babies, and I really enjoyed term infants. So that was where I decided I was going to focus my attention. But I was certainly bitten by the bug of research when I was able to train under Dr. Paula Meyer. Some of my work has been based on what is necessary at the time or in the place, because I do travel quite a bit. I've been in very different locations in the United States as well as in Israel. But one thing that is common and growing in terms of how common it is gestational diabetes mellitus, or GDM, which now faces about 10%. Approximately 10% of the pregnant population has GDM around the world. And so that is a growing issue. Other topics that I have focused on are topics such as smoking in pregnancy, which is based on where I was in rural Appalachia in the United States. There's a serious problem of health disparities, including higher risk for smoking in pregnancy in some of the women in the population. And so that became a focus of the work that I had done there when I was in specifically West Virginia. Now I'm in Southeast Ohio, uh, which is where Ohio University is located, and they also face health disparities, often related to health behaviors.
Mhm. Well, thank you for sharing your professional journey with us. What a wonderful background you have there. You started off with saying that you got bitten by the bug there when you gave birth to your children, and you met the IBCLC and lactation consultant there, and you were impressed. I have to tell you, as a midwife, I am very, very impressed with IBCLCs, and I refer to them every time. They're worth their weight in gold. So that's absolutely wonderful. And also that you then went on to nursing school, graduate school, research, and all that with little children. That's very impressive. And your work in Israel there as well. So let me ask you this. You're a professor there, and you have a doctorate in epidemiology. And unfortunately, I have to ask you this about, do you get a lot of questions now from your students about the coronavirus? And we'll talk to that just a little bit briefly.
Okay, well, we are going to talk about more chronic disease.
Yes.
Certainly, acute disease obviously is facing, it's a pandemic
Hmm.
facing us all around the world. It really is a global issue. In fact, today, just today, I'm currently in Israel, and the news just came out that yesterday a woman who was quarantined because of exposure to COVID-19 and indeed actually tested positive for COVID-19 just gave birth.
Mm.
And so they had to set up a specially equipped delivery room for her and for the baby, and transferred the mother to an isolation ward right after giving birth. Um, and the baby unfortunately had to be separated from the mother at that time. So even in maternal infant health, this is something that's impacting
Yeah.
us. And when it comes to lactation, my first thought when I saw that article and that news piece came up, I thought, oh, I hope they're encouraging her to be pumping milk,
Right.
even if she has to pump and dump at this point until she is virus free, hoping that her baby indeed has not contracted the virus,
Hmm.
that we're able to help her facilitate breastfeeding and lactation. That would be very important. So yes, it's impacting us everywhere.
Right.
One of the reasons I actually couldn't travel right now is because obviously international travel is not encouraged at this point, is quite discouraged.
Absolutely.
And so I think we all, being able to present this way online and still be an active participant in global education. I
Right.
think this is really we're stepping into the wave of the future here, and able to to help be part of the solution, which is to make education accessible, even if physical access is not possible.
Yeah, absolutely. And I see many universities have switched to online classes here in Florida. UF and others have done so already, which is wonderful. So people can still, continue their studies and their curriculum. And yeah, you brought up a very good point there. With, of course, lactating women, families are, very, very impacted by this. Do you know? And I don't think there is enough research yet. I think they have just a couple of babies born by mothers who have the COVID-19. If there is the virus been found in breast milk? Have you heard
I,
anything
I, I
about
have
that?
not heard. I have not heard yet.
Hmm.
But yes, it is very early in the process,
Right.
and I think that hopefully we will stay on top of it and
Yeah.
really be as proactive as possible to maintain safe lactation and breastfeeding.
Yes, and therefore good resources and expert like yourself are so important to educate us and help us stay on top of topics like that. Thank you so much. Now let's talk about your topic here that you will be presenting on delayed lactogenesis 2 in women with gestational diabetes mellitus. And you let us know that this is a special interest of yours and a research subject as well there. Talk to us a little bit about what this presentation will entail.
So we are going to talk about women who have GDM. As I mentioned before, it is the more common um, complication of pregnancy, actually,
Mhm.
affecting about approximately 10% of pregnant women worldwide. And we'll see with the presentation that
Mhm.
women seem to experience um, some difficulties and challenges with breastfeeding. And so as a researcher, I really wanted to understand the why. Why is
Hmm.
that happening? Not only what is happening for them to report it, but why is it happening? And then obviously the next step is what can we do about it? So I'm going to take everybody through a little bit of a journey that I've been on, because I've been studying this since, since 2007. I've been studying this topic. And so it's been quite some time, on and off, not
Hmm.
steadily the entire time. And it really depended on where I was at the time. But I will take you on a bit of a journey and share with you what I have learned in this journey.
Wonderful. Well, Dr. Ilana Chertok, thank you so much for this information. We're looking forward to the presentation. I can't wait now to hear from you and learn about this topic.
Thank you.
And for our listeners now, this presentation is a part of the lecture pack that I just earlier mentioned, the Complex Medical Issues in Lactating Parent lecture pack. This lecture pack will be available on March 30th here. And we have experts in the field of lactation that take us through the presentations such as this one, delayed lactogenesis and gestational diabetes mellitus. We also learn about supporting clients who are facing fertility treatment, dysphoric milk ejection, inflammatory disorders, and also breast cancer and lactation. I hope you will all join us. And to find out more about this presentation and the other presentations in the lecture pack, we invite you to visit goldlearning.com. Thank you again, Dr. Chertok, for talking with me here today, and to our listeners. Bye-bye, everyone.